Made time for a phone-in on BBC Radio Suffolk, where he admitted the government has to do more to get people back to work. He also took time out to tell me about his commitment to the war in Afghanistan and his gratitude to the troops. But first, this report from our political correspondent Andrew Sinclair.
This is an election year, and the Prime Minister is using every spare moment to draw attention to what he believes are his government's achievements. So this morning, in the marginal Norfolk seat of Great Yarmouth, he visited the local college and met young apprentices.
Very nice to meet you.
A few hours later, another marginal seat, Ipswich, and another photo op at a Sure Start centre. But there are other concerns too, which is why Mr Brown took time to visit personnel at the nearby Wattisham Airfield, home of the Apache attack helicopter. 200 personnel from here are involved in the current push against the Taliban. Others will be going out soon.
He was thanking us for everything we were doing. He believes in what we're doing is the right thing, and so do we.
How important is it to have a visit from the Prime Minister?
I think it is quite important. It shows a chance to show him what we do. And again, have a bit of feedback from him on his opinions and stuff.
This is very surreal, I have to say.
Well, it's very kind of you to have me.
Then he dropped into Radio Suffolk's lunchtime phone-in, a chance to field questions from the public on subjects ranging from Afghanistan to local issues. 59-year-old Pat Ramsey was one of the first to get through. She hasn't had a permanent job for nearly 2 years.
I hear a lot about what's being done for younger people to get them back into employment, and I fully support that. But there are a lot of us in the same situation as I am.
Well, Pat, you're absolutely right. We've got to do more to help not just young people who are looking for jobs, but help everybody who's looking for jobs.
He asked me whether the job centres had helped. Well, the job centres don't know what to do with somebody with my qualifications. You know, they don't know where to send me or what to do.
She has 3 degrees. The Prime Minister felt Pat Ramsey should be able to get work. He's promised to take up her case. We'll let you know how she gets on. Despite the polls, Mr Brown's staff say he's in a very good mood at the moment. He believes these regional tours are the best way of reconnecting with the public. More are planned as the election gets closer. Andrew Sinclair, BBC Look East in Suffolk.
Well, after he met the crews at Wattisham, I asked the Prime Minister about the terrible price troops from this region have paid in Afghanistan.
I'm meeting some of the bravest and most courageous people who are out there in Afghanistan, come back for retraining and going out again. And I'm very grateful for the service and the sacrifice that has been given by people who are trained soldiers, professional, but very, very brave and courageous people. And I mourn the loss of those people who have made the ultimate sacrifice for our country. They've been incredibly brave people, and we owe them a huge debt of gratitude. And to the family and friends, we have got to say that we, the British people, will always remember their sacrifice, which is to keep the streets of Britain safer and free from terrorism. And the reason that we're in Afghanistan is because we know that most of the plots, most of the terrorist plots that hit Britain start in that region of Pakistan and Afghanistan, and we've got to take the fight to the enemy there.
If we look at that helicopter behind you, it costs £30,000 an hour to keep it in the air, £100,000 every time you fire one of the missiles. How much longer can we afford to carry on with this?
We cannot afford not to. We cannot afford to leave our country unsafe from the threat of terrorism. We know that 3/4 of terrorist plots arise, not in Britain or in the rest of Europe, but arise from that Pakistan-Afghan area. And we know that to keep people safe in Britain, we cannot allow Al-Qaeda to have control of Afghanistan, and we cannot allow the Taliban to be back in power.
But after the next election, whoever wins, there's going to have to be some deep cuts somewhere. Can we as a nation continue to keep funding our armed forces?
It is true that 3 or 4 years ago, Afghanistan was costing us $600 million a year. It is costing us $4.5 billion in the coming year. So there's been a huge increase in expenditure on Afghanistan. But that is necessary because we want our troops to be fully equipped and properly equipped. And as long as our troops are in Afghanistan, they will have all the equipment that is needed, and they will have the finance that is necessary spent on them.
Does that mean cuts elsewhere, though?
What it means is we've got to be very efficient in the use of money in every part of the public sector, and we've got to achieve value for money in everything that we do. But the one thing I'm absolutely clear about, our troops in Afghanistan will be properly equipped, and they will be properly trained for the job that they're doing.
Will you tell us where the cuts are going to be then, Prime
And we will
Minister?
make sure that our troops in Afghanistan have the proper equipment. If there are to be changes in different areas of defence, It will be as a result of a strategic defence review. I think all parties agree that that is necessary. It will take place over the next few months. It's a necessary way of gauging what our defence priorities are. But the one thing that is absolutely clear, our troops in Afghanistan and troops going to Afghanistan will have the proper resources and the proper equipment, the proper training and all the support they need.
The Prime Minister speaking to me this afternoon, and there's more coverage of his visit on the website for BBC Suffolk, where you can also hear that phone-in. It's at bbc.co.uk/Suffolk.
More NHS patients have contacted Look East to complain about their treatment in what they're describing as a hospital cupboard. One said her experience at the Norfolk and Norwich was just horrible. We'll be hearing from the hospital in a moment, but first this report from Debbie Tubby.
A room without a view. Rhoda Talbot described it as a hospital storeroom. These photos were taken by her family, horrified she'd spent a night here.
Well, horrible. They just pushed my bed in. There wasn't much room. I don't think anybody should be put in a storeroom because that isn't very wide. There's shelves all up there, you know, everywhere. No.
Her son's now helping her to recover at home.
Tea, madam? I didn't feel anger or nothing like that until I went home and I thought, oh wow, my mum was in the stock cupboard in hospital, and I suppose then it got to me.
This time last year, Alan Reed claims he was put in a makeshift bed, stored away in a cupboard for 3 days, beside a pile of toilet rolls, before having his leg amputated.
All the time I was in there was nurses coming in, after medical aids, and they didn't think anything of it. You're left on your own, which, like, as a nurse went out of the room, she automatically turned the light off.
These cases came to light after this photo of 80-year-old Doris McEwen in the Norfolk and Norwich hospital made the national headlines last week. This is one of the so-called storerooms. Officially, it's called a clinical treatment room. Now, up until 18 months ago, the shelving would have been full of bandages and equipment. Now, there are still rooms in the hospital that have that. The Norfolk and Norwich says they're used when the other beds are full. After spending a night here, Rhoda Talbot says she never wants to be treated at the hospital again. Debbie Tubby, BBC Look East, Norfolk.
Well, Chris Baxter is the Director of Nursing at the Norfolk and Norwich Hospital. Earlier, I asked her why patients were being put into what looked like storerooms.
First of all, they're not storerooms, they are clinical treatment rooms, and they're fully equipped with oxygen and suction, and there's a bed and a bedside table, so exactly the same equipment that any other patient on the hospital ward would have.
But whatever you decide to call them, we've seen from the photographs there taken by the Talbot family that there are shelves stocked up, there are boxes there, and there's barely room to put the bed.
The bed space in the clinical treatment room is suitable for a bed and a bedside locker. Some of the treatment rooms do have some clinical equipment in there, but in terms of the patient's privacy and dignity, they're afforded exactly the same protection as any other patient would be.
The hospital itself admits, you admit, that these rooms are a temporary solution at times of intense pressure. So exactly how often are they used?
We use the clinical treatment rooms when all of the other beds in the hospital are full, and we use the clinical treatment rooms so that we don't have to cancel elective surgery for patients.
The obvious question then, the NNN doesn't have enough beds.
It's not a question of not having enough beds. I think because we've seen such a rise in emergency admissions, as other hospitals all over the country have seen, we have an escalation procedure so that when we run out of beds, we have got other areas to place patients and thus avoid having to cancel elective surgery.
Let me just put to you the point that Mrs. Talbot made. She says one of your patients being treated at your hospital there, she never wants to go back to the NNN, and her family are clearly angry. What do you say to them?
I'm really sorry that she feels that way. We try to provide the best possible care for all of our patients. And I have to say that if it was myself or any member of my family that had to go into a treatment room, I would be very happy for them to do so.
Chris Baxter talking to me earlier. Thanks to all of you who've been in touch about that. Don't forget, if you have a story to tell, you can ring or send an email using the Look East website.